Into this segment in the Element Well Studios. Joining us now, Wendy Bailey, Executive Director of the Mississippi Department of Mental Health. Wendy, thanks for coming in.
Thank you for having me.
All right, so May is Mental Health Awareness Month, correct?
That is correct.
So what should we focus on? What should we be thinking about, given that May is the month that we highlight this issue in our society? What should we be thinking about?
I think it's important to focus on recovery and how recovery is possible, receiving early treatment, and really acceptance. Just having a community and an environment where you can talk about your mental health. You know, we talk about our cholesterol and our blood pressure and all of our physical health problems, but a lot of times we're not as comfortable talking about our mental health, maybe depression, anxiety, and we all experience this.
Sure.
So it's important to really just have open communication, open dialogue, and acceptance.
Is there a tendency maybe for a person to just be in just defiance that they're even experiencing some sort of mental health problem?
I think a lot of times stigma and what we think other people are going to think can prevent us from wanting to seek help or to get help. And maybe we don't know how to seek help and how to get help. So a lot of that comes into play. But we know that 1 in 5 people have a serious mental illness. So it's very common. It's just not talked about as much.
What are some warning signs? How does one know?
So changes in your eating or your sleeping habits, withdrawing, losing interest in your activities, isolating yourself, feelings of sadness, depression, thoughts of suicide. These are all warning signs, but they're also things that we go through in our life at times. So what's important to remember is if it starts impacting your ability to go about your day-to-day life and activities, that's when you really need to reach out and you need to talk to someone.
It almost sounds similar to what addiction can do to a person.
It is. And co-occurring, which is what we call if you have a serious mental illness and you also have an addiction issue, a co-occurring disorder, those are very common as well, because a lot of times people who do have depression or anxiety, they may cope by using a substance or alcohol instead of receiving treatment. And that's something you absolutely have to be careful and watch out for.
If a person feels like they're experiencing these sorts of symptoms, what should they do? What's the first thing they should do?
So the first thing you should do is talk to someone. And that can be someone that you trust. That can be the faith-based community, maybe your pastor. We're doing a lot of education and awareness in the faith-based community. But there is a helpline in Mississippi. The Department of Mental Health has a 24/7 helpline. It's 1-877-210-8513. And there's also a website called mentalhealthms.com. And you can go and you can find resources in your local community. Find out what providers are in your area of the state. If you are having thoughts of suicide, though, or harming yourself or others, we say don't wait, call 988. And that is a number. It's a national number, but we have call centers here in Mississippi. And you will hear from a trained counselor that can walk you through help that you need.
What's the scope of the Department of Mental Health?
The Department of Mental Health actually has 3 areas under its umbrella. And a lot of times people don't realize that. It's mental health, addiction services, so that's substance use treatment, and then also intellectual and developmental disabilities. So we have state-operated programs across the state, such as the state hospitals, and regional programs for people who have intellectual and developmental disabilities, and community homes for people who have IDD. And then we also have a responsibility to certify providers across the state that provide community-based services.
Interesting. How long have you been with mental health?
I have been with the agency 17 years.
Wow.
I have been in this role as executive director for almost 2.5.
Okay. How has it changed from a legislative perspective? Anything happened notable this year, the past couple of years, measures that apply to the department?
We have had tremendous support from the legislature the last few years, not only with our funding request, but also just in legislation that's moving the system forward. There's a much greater understanding, I think, across the state of the importance of community-based services. You have a need for inpatient beds for those people who need that at that point in time, but really building out a continuum to make sure that we have the services available in the community to prevent someone from needing to go to a hospital.
Yeah.
So this year, House Bill 1222, which was authored by Representative Sam Creekmore, was called the Collaborative Response to Mental Health Act. And it focuses on ways we can divert people from needing that higher level of care, and also has a significant emphasis on law enforcement training, which is really putting another tool in a law enforcement officer's tool belt on if they encounter someone who has a serious mental illness, how they can respond and de-escalate and prevent a bad outcome.
Yeah. I read an article, I shared with you before we got on the air, Harvard Business Review, and when I checked it, even though I received it today, it was actually written in 2018. So I think because it being May Mental Health Awareness Month, they're redistributing that to their subscribers. And it's entitled, "We Need to Talk More About Mental Health at Work." And the article includes an analysis of just what it costs from a productivity perspective, and it breaks it down into economic terms when someone is inhibited because they're experiencing poor mental health and they're just not able to function and produce.
That's right. It affects your work productivity and days that you miss work. You know, we really have to shift our focus from we want our employees in a workplace to be healthy. But we really only think about that physical health aspect, and we have to look at the mental health aspect as well. I saw a commercial recently. I was actually out of state, and it shows this individual going through the process of he has cancer, going through treatments, and there's no words, and at the end it says you have to support your coworkers who have cancer. And it's no different for people who are going through a mental health issue as well.
Sure.
You have to rally around them and support them and help them and make sure that they're getting the help that they need. That's why EAP programs are employee assistance programs, where you can connect your employees with counseling and therapy are very important.
Yeah, so the article goes on to talk about how many large organizations are setting up treatment or at least some form of counseling, initial counseling available in the workplace from usually incorporated within the HR department to try to remove the stigma and to encourage, and they're training others and their employees to recognize the signs and to, as you said, to rally around other employees and just to talk it out with other folks and maybe work through it.
That's right. That's right. Really, that it goes back to that acceptance.
Yeah.
That acceptance and understanding that mental health is another part of your overall health and making sure that you as the community take care of the people that are around you.
Yeah, and it goes on to talk about our digital world, how that may be contributing as well. I see you shaking your head to the incidence of just mental health problems, that we need to be around other humans. That hasn't changed.
That's right. Isolating yourself. And if you are experiencing a mental illness, a lot of times isolation is part of that. And then if you isolate and go to social media, I have an 11-year-old and I wish he would never know what social media is. I understand there's some benefits to it too, but I think it also gives us the opportunity to see things through a filtered lens that's not real.
Yeah. Do you find, Wendy, that there may be some other environmental factors that are cropping up now, evolving, that are contributing to an increased incidence of mental health? Financial problems, for example, comes to mind.
Absolutely. There's been several large studies done on the impact after COVID, the impact of either the isolation and the social distancing and not being around your family and your loved ones, and then the impact of financial losses, the impact that it had in schools with children not being in school and having that socialization. And I think we're going to see that for years to come, not only in the mental health realm, but also in the addiction realm.
Yeah. Are there treatments? We got about a minute left. Are there also drug treatments or anything like that?
There's a wide range of treatments. Sometimes people just need outpatient therapy, some counseling, but there's also medications. There's self-care that you can do. There's a lot of different ways that you can take care of your mental health.
Makes sense. Well, May is Mental Health Awareness Month, and we should focus on that. We appreciate you coming in, Wendy. Thanks a lot.
Absolutely. Thank you.
Wendy Bailey, Executive Director of the Mississippi Department of Mental Health, has been our guest on Middays. We're taking a break right now, coming right back in the Element